Hi, I'm Doug Johnston. I'm the Chief of Cardiac Surgery here at Northwestern Medicine in the Bloom Cardiovascular Institute. And with me are Dr. Mohammed El-Kazzaz and Dr. Paul Kramer, two of my colleagues in cardiology, and we're here to talk about the pericardial program here at Northwestern Medicine. It seems like, and I think we would all agree, there are very few places where somebody can get the full spectrum of care for pericardial disease. What makes us a destination for pericardial disease care?
Northwestern Medicine has really been on the front of this disease entity with bringing the best in the field here. We're setting the center of care, that's number one. And two, we're also building clinical trials for the future and pushing the envelope, answering questions and filling gaps of knowledge.
We have the expertise in immunomodulatory therapies. And then for the patients that do need surgery, the technical expertise to do the right operation.
That's where we are so special as well, because we have you as an international, national expert in pericardial surgery, and it's not a very common surgery. We're able to operate with good outcomes on high-risk patients. So that's where we makes us so unique is the people, is the expertise of Chicago as well.
So maybe Paul, you can talk a little bit about, I'm a patient from Arkansas. I've been recently diagnosed with pericarditis. I don't really have anybody locally who is an expert in this disease, and I'm looking for some help. How does that work? If somebody reaches out to us from out of state, what can we do for them remotely?
The patient from Arkansas calls, they talk to a nurse coordinator who has expertise as part of our center and can review all the testing that's been done, then reviews it with one of us and you if needed, and we really decide what's the best course of action for the patient. And then they can come to us quite sick, but really if you get them through that, a couple months later, it's like a new person. So it's very gratifying for them. It's very gratifying for us as part of the clinical team.
And then when it comes to the sort of intensive diagnostic process, how we might transition somebody from, okay, you're being managed okay by your local doc, now it's time to come for a more intensive evaluation.
For that patient with recurrent pericarditis or incessant pericarditis who's not responding to those first-line treatments, that's someone who should get referred in. We have novel therapies that inhibit the inflammasome, which we think is the major driver of recurrent pericarditis, and other therapies down the pipeline with studies and clinical trials that will be available.
Well, I want to thank you both for joining me today. Just to remind you that we have a very easy way for you to get your patients in. We have an expert nurse coordinator for the pericardial disease program who is able to get all of the imaging loaded for us to look at. We can typically have a conversation within 24 hours about an outside patient and decide what the best course of action and how we can help you take care of your pericardial disease patients. Thanks very much.
Thank you.
Thank you.